Welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary anatomy and histology. Question number first. The following is vascular tunic of the eye. Options A, iris. Options B, cornea. Option C, sclera. Options D, retina. The right answer is option A, which is iris. Okay. Iris is the vascular tunic of eye. That means there's a supply of blood vessels in iris. Okay. If we see that the eye, we found there are many structures, just like there's the eyelid, eyelashes, conjunctiva, and eyeball. Among all structure, that eyeball is the chief apparatus which is responsible for visions, and it is located in that orbit and surrounding by that fat which protect it from that frictions. Okay. And if we see that the eyeballs, there are three major coat. There's a fibrous coat, vascular coat, and nervous coat. And the major content of that eyeball includes that aqueous humors, vitreous humors, and there's a lens. Okay. The fibrous coat is the outer protective coat of that this eyeball is mainly constitute of two major part. There's the anterior transparent 1/6 part of this fibrous coat, that's a cornea, okay, which is mainly composed of a corneal epithelium, and and the posterior that 56th part is known as sclera, which is mainly composed of white fibrous tissue and which is mixed with elastic fibers. Okay, and let's see some important structure which is present in sclera. Then there is a that area presents in a sclera which has the appearance of like a cribiform plate that is known as lamina cribosa scleri. Okay, and another structure that is a suprachoroid lamina, which is nothing, just a layer which is present between sclera and that the vascular choroid. Okay, and within this the junction of that sclera and the this uh, cornea, we found that there is a canal. Okay, that canal is known as canal of Schlemm's or sinus venosus sclera, and from the aqueous humors which is actually present in that anterior chamber, from that anterior chamber this aqueous humors goes toward this canal and move toward this the venous systems, and finally through that anterior ciliary vein. Okay, next, and let's move to the next coat. That's a vascular coat, which is actually lie between the fibrous coat and there is a, nervous coat. Okay, and it's mainly composed of three parts. That's a choroid, ciliary body, and iris. This choroid is a dark colored, thin vascular membrane, mainly composed of capillary plexus, small blood vessels, and loose connective tissue, and also contain pigment cells. Okay, let's we have to remember one thing in exam point of view. That's a tapetum. Tapetum is a structures reflecting structure which is mainly present in that animal which has the visions, nocturnal animal. Okay, and it gives greenish glare appearance at night. Okay, second is that ciliary body, anterior thickened part of this choroid, that is and this is known as ciliary body, and there's a and we found there's a fine fiber which is extend from this ciliary body to that capsule of that lens, and the main function is to that maintain the position lens in a positions, and this fibers is known as suspensory ligament. Okay, now, next part is that's iris, which is the anterior continuation of this vascular tunic. It is actually lied in that aqueous humors behind the cornea, but in front of the lens. And there's a central aperture, which is just a space, which is in a iris that is known as a pupil. Okay, the last and innermost coat, that is a nervous coat, which is mainly composed of retina. Retina is nothing but that's actually a membranous expansion of this optic nerve, and mainly composed of nervous tissue, blood vessels, pigment cells, and there is a modified connective tissue, which is arranged in 10 conventional layer. Uh, that's There's a pigment cells layer, then there's a layers of rod and cone cells, and there's an external limiting membrane, and there is an external nuclear layer, then external plexiform layers. There's an internal nuclear layer, and there's an internal plexiform layers, ganglionic cells layers, and there's a layer of nerves fibers and internal limiting membrane. Okay, and at the center of the posterior pole of this eyeball, the retina presents an oval yellow spot which is known as macula lutea, and at the middle of this macula lutea there is a depressed area which is known as fovea centralis, in which the sense of vision is very acute because the retina is very thin in this spot. Okay, there is a note that lamina fusca, which is a pigmented layer which is mainly present in eye. Okay. Question number second. The middle ear is located in options A, frontal bone, options B, temporal bone, option C, occipital bone, or options D, sphenoid bone. The right answer is options B, which is a temporal bone. Okay. The middle ear is actually located in a temporal bone. Okay. Let's see some fact about that ear. Okay. Ear is actually the organ which is mainly associated with that hearing and that balancing the body, which is equilibrium. And if you see that ear, it is mainly composed of three major parts. That's external ear, middle ear, and internal ear. Okay, external ear is also divided into two major part. There's a pinna or auricle, or next is that there is a pinna and auricles, and second part is there's acoustic meatus canal. Okay, this pinna and auricles is if you see that's roughly an elongated funnel-shaped structures which having two surface. There's the anterior surface and the posterior surface. The anterior surface mainly include there's an opening of external ear, while posterior surface is covered by hairy skin. And it also composed three major cartilage, which is known as conchal, scutiforms, and annular. And second part is external acoustic meatus, which is actually a canal which lead that medially toward that middle ear. Okay, and it's mainly there's a lining epitheliums of that aquatic meatus canal, mainly composed of sebaceous and Sweat's glands, which mainly secretes that ear wax, okay, or cerumen. And at the border of that external ear, and there is a in middle ear, a membrane is present, which is known as eardrums also, and or tympanic membrane. And this tympanic membrane, if you see, that is derived from all three germinal layers, that's ectodrum, mesodrums, and endodrums. Okay. Now, the middle ear, which is also known as a tympanic cavity, if we see that's middle ear, it is irregular, biconvex, small space, which is also lying that temporal bone. Okay, and it's mainly contain three ear ossicles. That's malleus, which is actually hammer-shaped bone, incus, which is anvil-shaped bone, stips, which is stirrups-shaped bone, and there's also a part of coda tympani. Coda tympani is nothing; it's just a branch of facial nerves which moves toward that middle ears and passes from the middle ears. Okay, and also some muscles and ear. Okay, if we see that anterior wall which presents that opening of that canal, and it lodges that tensor tympani muscles, and also there is another opening of that stations or auditory tubes. This stations and auditory tubes is actually the tube which is connected this middle ear with that the pharynx, and play a major roles in maintain atmospheric pressure. Okay. Next, moving toward that internal ear. That internal ear is the main portions of that organ which is responsible for hearing, and it is also situated in that temporal bone, and it consists major two part, that's osseous labyrinth part and membranous labyrinth part. And this space between this osseous labyrinth and membranous labyrinth are filled with fluids, and this fluids is known as perilymph. Okay, if you see this composition of this perilimbs, it's resemble that cerebrospinal fluid. Okay. Okay, then osseous labyrinth may comprise of that's a vestibules, cochlea, and semicircular canal. Okay, while membranous labyrinth includes there's a cochleal duct and saccules and utricles, and there's a three duct of semicircular canal. Okay. Uh, Okay, that vestibules is actually a bony cavity which is located medial to this tympanic cavity, and is continue to this cochlea in front, and semicircular canal behind side. Okay, and the semicircular canals is attached to this vestibules by five orifice. Okay, and it's that at the vestibules we found there's a two membranous labyrinth structure, that's a utricles and saccules. Okay, and second bony labyrinth structure, that is a cochlea. It's a bony spiral canal uh, winds into that 2.5 turn, and if you see that's appearance, it has appearance as like a shell of a snail. Okay, and afterward there's a semicircular canal which is a curved tube, actually three in number, anterior, posterior, and lateral, and all the terminal part of this tube at their junction with the vestibules. They are dilated to form ampullae, and we already discussed that the semi-circular canals connected with vestibules by mean of there is a 5 orifice. Okay, and there's a membranous labyrinth which mainly includes a cochlear duct. Okay, this cochlear duct is that membranous cochlea is mainly formed by basilar membrane. Okay, and second is there's a saccules and utricles which is mainly located in the vestibules, and that utricles is larger than saccules, and they both are communicate each other by utricosaccular duct. Okay, and we also found there's a three duct of semicircular canal which shape as same as like of a semicircular canal, osseous semicircular canal. Okay, and the cavity of this membranous labyrinth is actually filled with endolymph. Okay, next is there's an organ of Cotine, which is actually a major organ or sense organ of hearing, which is situated on a basilar membrane, and it's mainly contain hair cells. And there's a tunnel of Cotine, and there's a tectorial membrane, and also spiral ganglion. Okay, here is a note that's the neuroepithelial area which is present in a semicircular duct of ear that is known as crista ampullaris. This crista ampullaris, so one times asks in a questions too, so we should remember about this crista ampullaris. Okay, questions number 3. Syndesmochorial placenta is seen in options A, mare, options B, cattle, option C, that's a dog, options D, cat. The right answer is options B, that is a cattle. Okay, syndesmochorial placenta is seen in cattle. Okay, here is a classification of a placenta that's on the basis of a gross shape of placenta. In case of that mare and so, we found as a diffuse type of a placenta. In case of a ruminant, we found there's a cotyledonary placentation. In case of dog and cat, there's a jonary placentation. In case of human and monkey, there's a discoidal shape of placentation. Okay, if we see that's microscopic structure, then in case of mare and so, there's epithelio corial. Only epithelial layers is attached. Okay. In case of a ruminant, then it's moved toward that syndesmocorial. Okay. In case of a dog and cat, there's a endothelium up to endothelium, endothelial corial. Okay. Human and monkey, there's a hemocorial. Okay, and if we see that's on the basis of the loss of the maternal tissue at the time of birth, then we found that the in case of dog, cat, human, monkey, which is deciduous, this means there's a loss of maternal tissue at the time of a birth. Okay, while in case of a mere show and ruminant, since the placenta is only attached to the surface layer of that the mother, so there's a loss of maternal tissue at the time of birth is null. There's no loss of tissue of at the time of birth, so the placenta is non-deciduous types. Okay, questions number 4. The urine is stored in the fetus temporarily in options A, amnion, options B, allantois, option C, yolk sac, options D, chorion. The right answer is options B, that is allantois. Okay, urine is stored temporarily in the fetus in allantois membrane. Okay, uh, since there are fetal membranes are nothing. There's a membranous structure which is actually surround the embryo during its development period, and it mainly includes amnion, chorion, allantois, yolk sac, and umbilical cord, and it is mainly developed from the zygotes. Okay, this embryo actually lie external to that embryo, therefore it is this membrane is actually lie external to this embryo, therefore it is also known as extra embryonic membrane. And its major functions includes like protections of the embryo and nutrition and respiration and excretion. Okay, if we see that the chorion and amnion do not take part in that formation of embryo or fetus, while that yolk sac actually incorporates into embryo and incorporates of the embryo, and it's lead to the is lead to the formation of primordials of gut, or while allantois help in the formation of a fibrous coat, that is urachus. Okay, and if we see that's this fetal membrane, then chorion is that outermost fetal membrane. Amnion lie between this chorion, and the amnion is that innermost fetal membrane, while allantois lie between this amnion and chorion. Okay, and this amnion, the major function of this amnion is that protection of this embryo by providing hydrostatics cushions, and which protect that embryo from that shock and there's a frictions. Okay, and while allantois, major function of allantois is that it It helps the embryo to exchange the gases and also take part in removal of that nitrogenous waste from this the fetus. Okay. Questions number 5. Meckel's diverticulum is anomaly seen in the development of options A. Respiratory systems, options B. Urinary systems, options C. Genital systems, options D. Digestive systems. The right answer is options D. That is digestive systems. Okay. Meckel diverticulums occurs in a fetus in that the early pregnancy times. It is nothing. It's just a vitelline duct which connect the growing fetus with that yolk sac. Okay, and it is absorbed into that fetus normally in normal conditions. But when the vitelline duct is not fully absorbed, then we found there's a Meckel diverticulums is developed. Okay, this Meckel diverticulum is a true congenital diverticulums, and it is a if we see that is a slight bulges in that small intestine, and it is mainly most commonly found in that horse and swine. Okay. Questions number 6. The mesoderm's derivatives is options A, heart, options B, liver, option C, spleen, options D, testis. The right answer is option uh, mesoderm derivatives options D, that is testis. Okay. Testis is derived from mesoderms. We all know there are three germinal layers, that is ectoderms, mesoderms, and endoderms. Let's see the different organs which is derived from these three germinal layers. Then if we see that the GI tracts actually from that pharynx up to that upper rectum, which is derived from this endoderms, and liver and pancreas. Also there's a respiratory epitheliums and middle ear, urinary bladder, thyroids and parathyroid glands are derived from this endoderms. And if we see that mesoderms, then muscles actually and all bones and connective tissue except the bone and connective tissue which is present in head, which is actually derived from that ectoderms. Okay. Similarly, dermis layers is derived from that mesoderms, except the dermis which is present in head and neck regions, which is actually derived from that ectoderms. Okay. And if we see that's adrenal gland, which is derived from that the mesoderms and ectoderms both. The adrenal cortex part is derived from that mesoderms, while adrenal medulla part is derived from that ectoderms. Okay. And reproductive systems, circulatory systems, urinary systems. These three systems are derived from this mesoderms. Okay. And in case of ectoderms, the nervous system is derived from that ectoderms, epidermis is derived from that ectoderms, and mammary glands derived from that ectoderms, penile urethra is derived from that ectoderms. Okay. Questions number 7. The first pharyngeal pouch differentiates into options A, Stachan tubes, options B, palatine tonsils, option C, thyroids, options D, thymus. The right answer is options A, that is Stachan tubes. Okay. Stachan tube is derived from a first pharyngeal pouch. Okay. Let's see the derivatives of this pharyngeal pouch. Then tympanic membrane, which is also known as a middle ear cavity, or Stachan tubes. These all are derived from this first pharyngeal pouch. Okay. While palatine tonsils and tonsillar fossa is derived from second pharyngeal pouch. Inferior parathyroid glands and thymus is derived from that third pharyngeal pouch, while superior parathyroid glands or parafollicular cells, which is mainly present in that thyroid glands, which is also known as C cells, responsible for the synthesis of calcitonin hormones, is derived from that fourth pharyngeal pouch. Okay. Questions number 8. The taste bud are seen in options A, filiform papillae, options B, fungiform papillae, option C, conical papillae, options D, foliate papillae. The right answer is options B, that is a fungiform papillae. Okay. Taste buds are found in fungiform papillae, and if we see that tongue, that's a tongue is highly mobile muscular structure which is responsible for prehension. Prehension means that receiving the food from the source up to that mouth. Okay, mastications, and also it's helping deglutinations. Okay, that's swallowing. Okay, also play important roles in taste. Okay. And it's mainly situated on the floor of the mouth between two rami of the lower jaw, and it has the root structures and body and apex. Okay. And if we see that's a tongue, it is mainly composed of pigmented mucous membrane, and there is a muscles, there's a gland, there's a vessels and nerves, and a fold which is connected this the tongue to the ventral surface of this the floor of the mouth, that is known as a frenum linguae, okay, which is a fold of mucous membrane, okay. And if we see, that's the dorsal surface of the tongue that contain many papillae, okay, that's a filiform papillae, fungiform papillae, lenticular and valid papillae. Among all papillae, that's fungiform papillae bear actually taste bud. This taste bud, if we see, that's clearly has an oval shaped body, neck, and there is a taste pore. It's mainly comprises supporting cells and taste cells, okay. Questions number 9. The smooth surface kidney are present in options A, cow, options B, buffalo, option C, bull, options D, sheep. The right answer is options D, that is a sheep, okay. Uh, Kidney of the cattle, buffalo, and bull, if we see, there's a lobulated and bean or roughly oval shaped, okay. While kidney of sheep and goat, that is a bean shaped and smooth, okay. If we see, that's kidney of horse, then the right kidney is heart shaped, while left kidney is bean shaped, and their surface is smooth, okay. If we see, that's kidney of dog, cat, rabbit, then we found there's a bean shaped and smooth, okay. And kidney of pig, that is bean shaped but it is lobulated. And we see, that's kidney of fowl, that's elongated and lobulated, okay. Questions number 10. Hussel's corpuscles are seen in options A, pituitary gland, options B, liver, option C, thymus, options D, pineal gland. The right answer is option C, that's a thymus, okay. Hussel's corpuscles, which is also known as a thymic corpuscles, are the structures which is mainly found in that medulla regions of this thymus, and it's mainly composed of eosinophilic type 6 epithelial reticular cells, which is actually arranged concentric manner. Questions number 11. The number of paired pronephric tubules are seen in the early part of the development of kidney are about options A, 3 pair, options B, 7 pair, option C, 15 pair, options D, 30 pair. The right answer is options B, that is a 7 pair, okay. The number of paired pronephric tubules which is seen in that early development of kidney are about 7 pair. Let's see the embryonic development of kidney. Then if we see that the kidneys actually developed from the intermediate mesoderms. We already discussed that the urinary system is derived from its mesoderms, okay. And a portion of this mesoderms that condense to give kidney are known as nephrogenic codes, okay. And if we see that's the stages of development, then we found there's a 3 stages of development. First, there's a pronephros, and there's a mesonephros, and there's a metanephros. Actual permanent kidneys form from that metanephros, while the pronephros is the part which is functioning as like a kidney excrete out that waste matters during the early times period. And when it's degenerate at the time that mesonephros performs as like a function of like a kidney, and then mesonephros degenerate, actual kidneys form from this metanephros, okay. And the number of the paired pronephric tubules which is seen in that early development is 7 pair, and the number of this paired mesonephric tubules which is seen in early part of development, that's 30 pair, okay. There's a certain anomalies which is related to this kidney. There is a horseshoe shaped kidney. Horseshoe shaped kidney is formed due to the fusions of this metanephric primodia of this two side, which is lead to this anomaly and which lead to give that kidney as like a appearance as like a horseshoe. That's known as horseshoe kidney, okay. Cystic kidney is a conditions where there is a flow of the urine is blocked due to the failure of its communications between a secretory part and excretory tubules in the development of kidney. And third is there's a pelvic kidney, which is actually the anatomical defect when the kidney which is fail to rise to their normal positions during embryonic development and remain in the pelvic regions. Such type of kidney is known as pelvic kidney. And there's a frog ureter, which is also known as duplex kidney, is another anomaly where that two ureters is draining urine from a single kidney, okay. Questions number 12. The portion which form uterus and vagina from the Mullerian duct persist in a male in a rudimentary form, represented as options A, colliculus seminalis, options B, testis, option C, appendix testis, options D, uterus masculinus. The right answer is options uh, D, that is uterus masculinus. Okay. Uterus masculinus is nothing. It's a portions which form uterus and vagina from this Mullerian duct. If it persists in a male in a rudimentary form, that is known as uterus masculinus. Okay. While colliculus seminalis is a rounded prominence which is situated distal to the entrance of this ejaculatory duct. Okay. And if we see that's a mesonephric duct and Wolfram duct, which is lead to gives male reproductive systems, while paramesonephric or there's a Mullerian duct, which is lead to give a female reproductive duct. Okay. Questions number 13. The cranial group of mesonephric tubules in female persist as options A. Epoophoron, options B. Parophoron, options C. Gartner canal, options D. Clitorius. The right answer is option A, that is Epoophoron. Okay, the cranial group of mesonephric tubules in female persist as Epoophoron. Okay, Epoophoron is nothing. It's a rudimentary organ which is homologous with that male epididymis that lie in the broad ligament of the uterus, and it is actually that the cranial group of this mesonephric tubules. Okay, while parophonophron is a group of rudimentary tubules in the broad ligaments which is lie between this the epoophrons and the uterus, and it's mainly constitutes a remnant of the lower part of this mesonephrus in a female corresponding to the paradidymis of male. Okay, while the Gartner canal is the embryologic remnant of the Wolffian or mesonephric duct. Okay. Questions number 14. The double fold of peritoneums passing from stomach to other viscera is termed as options A, omentum, options B, mesentery, option C, ligament, options D, fascia. The right answer is options A, that is omentum. The double fold of peritoneum, which is passing from stomach to other viscera, is termed as omentum, while the double pore of peritoneum, which is attaches the intestine to the wall of the abdomen, is mesentery. Okay, and the double fold of peritoneum, which is attaches the viscera other than the part of the digestive tract to the wall of the abdomen, that is known as ligament. Okay, and the double fold of peritoneum, which is extending from the liver to the parietal surface of omasum, is known as lesser omentum. Okay, the double fold of peritoneum, which is extending from the greater curvature of the stomach to the transverse colon, that is known as greater omentum. Okay, and the peritoneum, so which is reflected and form a pouch between the rectum and a sacrum, that is known as sacrorectal. Okay. Questions number 15. Honeycomb appearance is seen in the interior of options A, rumen, options B, reticulum, option C, omasum, options D, abomasum. The right answer is options B, reticulum. If we see that's interior surface of this structure, then we found that the rumen has a towel-like appearance, while reticulum has honeycomb-like appearance. Omasum has a multiple fold-up presence in there, which is look like as a lady's purse. Okay. Abomasum has a smooth surface which contain many glands. This is known as glandular. And abomasums, if we compare with that the uh, non-ruminant animal, then it's actually the true stomach. Okay. Questions number 16. Cecus is related to the organ in equine is options A, liver, options B, abomasum, option C, cecum, options D, colon. The right answer is option okay. The right answer is option B, that is abomasum. Cecus is the regions which is located in a esophagus at the entrance of that stomach where that food first comes in contact with acids in equine. Okay. Questions number 17. Margoplicatus is a line which separates a non-glandular and glandular part in the stomach in options A, cattle, options B, buffalo, option C, horse, options D, sheep. The right answer is option C, that is a horse. Margoplicatus is a line which is actually separates a non-glandular part and a glandular part of the stomach in case of a horse. Okay. The horse stomachs contain two different type of surface. The non-glandular, which is mainly includes squamous mucosa cells, which is located on the top half, and which is a pale pink and shiny in color. While the glandular mucosa, which is located on the bottom half, and is darker in color and mainly contain stomach's acids producing cells. Okay. And the gastric ulcers can occur in either locations, but the most common occurs along the joint in the different surface of the stomach, that is margoplicatus, or also it can occur in the squamous portions, which is the upper portions. Questions number 18. Ileocecal and cecocolic orifice in the cecums of horse is present in options A, apex, options B, the base, option C, greater curvature, options D, lesser curvature. The right answer is options D, that's a lesser curvature. Ileocecals, the orifice which is communicate between the ileums and cecum, and the cecocolic, that cecums and colons communicated by this cecocolic orifice, are present in that lesser curvature of cecums of horse. Okay. Questions number 19. The scythe shaped spleen is present in options A, bird, options B, horse, option C, dog, options D, sheep. The right answer is option B, that is a horse. The scythe shaped, which is means roughly triangular shaped spleen, is seen in horse. Okay, the oyster shell shaped spleen is seen in sheep. Elliptical shaped spleen is seen in cattle. Human footprint shaped spleen is seen in case of dog. Elongated and spatula shaped spleen is seen in case of rabbit. Small, round, reddish brown spleen is seen in case of fowl. Okay. Questions number 20. The paired cartilages in that larynx is option C, arytenoid, options B, epiglottis, option C, cricoids, options D, thyroids. The right answer is options A, that is the arytenoids. Okay. The larynx is an actually elongated musculocartilaginous structures which is located between pharynx and the trachea, and it consists of following types of cartilage, just like a thyroid cartilage, cricoid cartilage, arytenoid cartilage, and epiglottis. Okay, and if we see that thyroid cartilage is the largest cartilage among all four cartilages, and its shape is shield shaped. Okay, cricoid cartilage have a signet ring shaped cartilage. Okay, arytenoid is actually paired cartilage. Epiglottis has a leaf or plate-like structured cartilage. Okay. Questions number 21. Dapson and Danely describe the cell's membrane as options A, unit membrane, options B, bilayer of lipid, option C, sandwich model, options D, fluid mosaics models. The right answer is option C, that's the sandwich models. Dapsons and Danely describe the cell membranes as sandwich models. According to them, that's the protein's layer is light between the that upper side there's also lipid layers, lower side also there's a lipid layers, and between them there's a protein layers, which is as like a sandwich models. Okay. While David Robertson's give unit membranes model of cell membrane, according to him, that's all cell membranes are made up of single cell membranes. Okay. Singer and Nicholson's proposed fluids mosaics models. According to them, there's a in a in a in a fluid of lipid, the protein float. Okay. A note: there's a thickness of a normal thickness of that cell membrane is approximately 8 to 10 nanometers, which is 10 to the power minus 9 meter. Okay. Questions number 22. If the centromere presents at one end, then it is termed as options A, metacentric, options B, submetacentric, option C, acrocentric, options D, telocentric. The right answer is option C, that is acrocentric. Okay. Let's see the classification of a chromosome on the basis of the position of centromere. Then metacentric chromosomes are those chromosomes in which that centromeres lie at the center. Submetacentric chromosomes where the centromere is slightly away from the center. Acrocentric chromosomes where the centromeres which is close to one of the end. Okay, while telocentric chromosomes where the chromosomes having a terminal centromere. Okay. Questions number 23. The intercellular junction which prevents the leakage of the materials from the lumen is options A, zonula occludens, options B, zonula adherens, option C, macula adherens, options D, nessus. The right answer is options A, that is a zonula adherens. Okay. The right answer is options A, which is that the zonula uh, occludens. Okay, 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 okay. Bigrio.